بسم الله الرحمن الرحيم والصلاة والسلام على سيدنا محمد وآله وصحبه أجمعين. Good afternoon, ladies and gentlemen. First of all, I am honored today to be representing my Ministry of Health as per the instruction of His Excellency, the Minister of Health. And also I'm honored that I'm meeting esteemed guest speakers to discuss about one of the most important subject, which is the rare diseases. And really, I do admire all of you while you are doing a great job in supporting the patients and mainly the children, which really they are in need of such help, treatment, prevention, predicting, and the follow-up. And not to forget the pharma industry, which really they have a great role in supporting different type of medical treatment programs worldwide. Before starting my presentation, I would like to raise a question here to you. What do you think the most expensive medicine will cost to treat one of the rare diseases? Just give me a figure in terms of thousands of millions. 2 million, 2 million. It's not an auction, you can increase. In fact, the most expensive medicine to treat one of the most rarest disease worldwide, it's 7.35 million Emirati dirham. And so far, we are so lucky that by the grace of God and by the support of the government of United Arab Emirates, and mainly His Highness Sheikh Mohammed bin Rashid Al Maktoum, Vice President, Prime Minister, ruler of Dubai, 3 of the patients' children had this medicine in the UAE free of charge. By the support of His Highness and by grace of God, as I said at the beginning, and by the support of the people who live in this beautiful country. And this is a strong indication for all of you that how much UAE is behind supporting different type of healthcare services, healthcare sectors, different type of diseases, and especially today we are talking about the most rarest group worldwide. As per the definition of the WHO and the United States of America, the rare diseases, it differs with different definition, but mainly it's the disease that is uncommon and it's being spread in a small or a bigger number of population. It has been indicated that there are almost 7,000 rare diseases has been identified internationally. And almost 475 million people, they are carrying such different type of rare diseases globally. 1 out of 15 people worldwide has been affected or affected by different type of rare diseases. And this is something gives us a sort of warning that it's very important to start programs in terms of prevention, predict, testing, diagnosis, to make sure that how we will be able to protect the population from different type of genetics or genomic diseases with the newborns, mainly because it's inherited from the both parents. 80% of the rare diseases, in fact, either genetic or genomic, and it has been mainly affected the children. And therefore, here comes the importance of your role as a health professionals, as a doctors, pharma industry, R&D, to support in either predicting, diagnosis, and helping those children. 1 out of 3 hospital beds worldwide, it's being designed for those rare diseases worldwide. And 7 years is an average time of diagnosis, which it means that many of the countries, even among developed countries, they don't have their national program to predict different type of genetic diseases and rare diseases. And therefore, maybe 7 years later, at the age of that single child, the discovery will be like a exposure to the parents. And you have also to consider how much that child will suffer in his life because has not been detected or diagnosed at the early age of that single child. And here comes the importance of the national programs in different countries. I'm so proud that I was the one with my sister, Dr. Maria Motar here, which we both together presented the pre-marriage program, national program of United Arab Emirates to the cabinet with the presence of our Minister of Health, and that was in 2007. And since then, UAE were the pioneer among the region, pioneer countries among the region in introducing the pre-marriage marital testing. Mainly at that time, the testing was HIV/AIDS, hepatitis B surface antigens. Test was done for hepatitis B virus and also the hereditary diseases, which is very common in the region, like thalassemia, sickle cell anemia, and rest of the hereditary diseases. Today, I'm standing at the front of you representing as a normal staff in my Ministry of Health and Prevention, responsible of sector of pharma and medical industry. I can announce that UAE become one of the best countries to have a strong program in genomic testing, and also the program which has implemented more than 10 years back to predict different type of genetic diseases and rare diseases among the among the newborns. 5% of the people with the rare diseases have a treatment. This is not in my beautiful country, the United Arab Emirates. My country, everyone, Emiratis, non-Emiratis, you have a health insurance or you don't have, you live here, you are the one can get the support either from the federal or local governments or from the charities or from the His Highnesses to help and treat that different type of rare or genetic diseases. But huge number of countries worldwide, they don't have health insurance programs, or their health insurance programs scheme, it doesn't cover the rare diseases. And it's very important as a recommendation of this conference that how to include or enroll rare diseases among the insurance schemes or programs. And also maybe due to their economical difficulties, or they don't have a system or a policy in their ministry to provide the proper quality of healthcare services, not even to the people who lives in their country, but to the inhabitants and their nationals. But in my country, which is your country, we are so proud that we have a great support, and not a single person who lives in this beautiful country will suffer from not receiving treatments in specialized hospitals like Al Jalila, or not to receive even the most expensive medicine, which I mentioned, which it costs 7.35 million Emirati dirham. Internationally, as the importance of the rare disease, the United Nations has been released a resolution, and that was December 2021. I don't want to go into the details. You as a health professional and specialized in the rare disease, I'm quite sure you know this better than me, that this resolution has been signed by more than 193 countries, adopted by all of them. And this resolution talks about many things: inclusion and participation of the society to support the people and their country and ensure the universal access to the most innovative treatments. And you know that UAE is one of the countries which either we are number 2 or number 3 worldwide to introduce the most innovative medicines approved either by FDA in the state or EMA in Europe, that to allow the patients in the UAE to have an access to most innovative medicines, even for the rare diseases. And also to concentrate on the personalized medications, and to make sure that the rare diseases comes into your policy programs and in your strategy, that you as each single country has to have the strategy and policy for predicting and pre-screening with the newborns to discover different type of new diseases. If I'll talk about my beautiful country, the United Arab Emirates, we are so proud to say that many years back, we started with Emirates Genome Program, or we call it Emirates Genome Data Bank. It was started as an initiative from Ministry of Health and Prevention with the support of different authorities Today, it's being mandated that G42, that's one of the leading local companies in the UAE, which they own Sinopharm. I'm quite sure it's very famous to you as a COVID-19 vaccine. As a part of their function, they have one of the state-of-art genetic lab in Abu Dhabi. It's the rule now, and which started aggressively in the UAE to do the UAE genome and to find out which type of the genes are present in the population of United Arab Emirates, mainly with the Emiratis, and also later on the second stage with the population. And not to forget that as the support from our father, Sheikh Zayed bin Sultan Al Nahyan, and support by Sheikh Fatma, to establish the Zayed Genetic Center in London. And this is a sort of support that how we will be able to do research and development and to discover the different type of rare diseases among the populations, and to make sure that how we could co-op and deal with the pharma industry for the production of the new type of medications for different type of new diseases. And not to forget the attraction of the most innovative and modern medications. As I said, UAE is one of the leading countries to introduce the most innovative medicines as soon as being approved internationally. This will allow that the patients has an access to most innovative medicine, allow and supports the medical tourism, supports you as a health professionals that you have the access to help your patients, and also enhance the facilities which is being provided among different hospitals based in the UAE, and mainly the specialized hospitals as a hospitals responsible for the treatment of different type of diseases with the children's, like Al Jalila Hospital, and we have Sharjah Al Qasimi Maternity Hospital and Al Corniche in Abu Dhabi, and rest of the hospitals all over the United Arab Emirates. We as a UAE also, we have a huge number of the programs to support our patients, and the partnership with the pharma industry. We have a visiting doctors, which we used for more than 24 years, that for some of the rare diseases and complicated cases, and instead of sending our patients abroad, still we are sending a few number, but has been decreased because we have a visiting doctor programs that most eminent doctor could come to the UAE and follow up with the rare diseases or the complicated cases here in the United Arab Emirates. As I said, the pre-marriage perinatal testing program, which has been started in UAE as a first country in the region long time back, and also the support of the people who lives in this country, not even the Emiratis and even the expat, either through the insurance program or the charities or the His Highnesses. And also we have a great support from the NGOs, which they have a base here. And maybe you don't know that 3 big NGOs, they have a base here. The United Nations, they cover more than 5 regions, by the way. They are based in Dubai, humanitarian city. And also we have the Federation of the Red Cross and Red Crescent. They have a base in the UAE, and the WHO, which again, they have a base in the UAE, and their support is crucial to provide the essential medicines and to provide the most important medications for different countries. And we have a great support from Ministry of Health of the Foreign Affairs of the UAE and Emirati Red Crescent to support different countries, and their support also in many occasions to help the non-Emiratis, which they don't have the ability to treat their children with the most expensive medications, or treatment is being supported by the NGOs in the UAE. I will conclude my presentation with this beautiful photo of His Highness Sheikh Mohammed bin Rashid. He said something in Arabic. I'm quite sure everyone can read it. Now, His Highness and our beautiful country are trying since many years back to allow the disabled people to be the leaders, to be the most active people, productive people in the community. They are not disabled. They are able, they are productive, and they are active, and they have a huge input to the community of United Arab Emirates. Let me also share with you one of the statements of His Highness Sheikh Mohammed bin Rashid Al Maktoum, which he said, the brains the ideas, the innovations, suggestions of the people. Wherever they go, a sort of prosperity, improvements will take place at that place. And therefore here, we have all of you here, Emiratis and non-Emiratis. We are being honored to have more than 200 nationalities living in peace in this beautiful country. Therefore, you are able or disabled, with your brains, with your ideas, with your initiatives, with your support, your suggestions, we will be able to improve quality of services in this beautiful country, United Arab Emirates, and also to help those needy patients with rare group or patients with other diseases. Thank you very much.